Bismillahirrahmanirrahim. Assalamualaikum dear students. My name is Dr. Hira and I'm your course instructor of evidence-based practice. As you know that we are currently we have started the remaining course which we have scheduled in the initial when we discussed the course outline. We have discussed these topics to be done afterwards summits because in the initial phases and in the initial actions we were actually discussing about the steps of the EBP, how to search literature, sorry, how to use a number of databases, search engines in order to retrieve a lot of literature, and then we discussed about a lot of concepts related to EBP, its application into the real world practice, and a lot of things related to this. And then we discussed about reliability and validity. And afterwards, after the right after your myths, in the last lecture, in the two lectures that we conducted last week, we discussed about the sampling technique because when you people were studying literature and when you were discussing the articles with me in order to learn critical appraisal, you were very much confused about this term and that and this term. Including the sampling technique, what is this, what is that study design. So I have decided to cover those topics first about which people were very confused. In the last week, I have discussed thoroughly about the sampling techniques, and now I would like to introduce you with a new term that is actually not new for you because you have heard about it many times when you were discussing the checklist of critical appraisal and you were thoroughly reading an article. So there was a term used as biasness, bias. There can be bias in the even I remember in the last lecture, 2 to 3 students asked me that, madam, what is this biasness? What is this bias? What is this kind of sampling error? So I told you that I will tell you about the bias in the research in the next lecture. That is why I am starting with the bias in the research. Let me check whether this lecture is being recorded or not. Um, Okay, this is being recorded. So let's start with the presentation. Bismillahirrahmanirrahim. What is the bias in the research? So what is the uh, simple meaning of bias? This is kind of deviation. This is kind of biasness, some favoritism, some favorism. So let's see that what is the true meaning or true definition of bias in the research. What are the learning objective of today's lecture? First of all, we will have an introduction and definition of bias, where bias can happen, when bias can happen, what are the sources of bias, how we can classify bias, what are types of bias, how can we measure, how we can take measures to minimize bias, what is confounding variable, and summary of the lecture. So this is about the learning objectives of today's lecture. And in the last lecture, we were discussing about the sampling techniques. So let's have a very quick overview. There are two types of sampling techniques. Actually, one is considered as a non-probability, and the other one is considered as a probability sampling type. In the probability sampling type, there is equal chances of every person of the population of being selecting, well, in the non-probability or in the non-random sampling, the chances of every person who is in a population who belongs to a specific population, the chances are not equal. So this was the basic difference between the random or the probability or non-random or non-probability sampling technique, and they were divided into some other types as well. There was convenience sampling, quota sampling. There was your judgmental sampling, systematic sampling, a lot of types, quota sampling, snowball sampling. So they were the types that I have told you thoroughly in the lecture, in the recorded lecture and in the interactive lecture as well. But still, if you have any confusion regarding these terms, you can ask me. So let's start with the bias. What is bias? Bias. The definition of bias in the research, it is in systematic deviation from the truth. This is a systematic error which can occur in the designing of a research, in the conduction of a research, or in the analysis portion of a research that results in distortion of the facts or of the truth. So, this kind of error that is taking place in the research process is can occur at any level, which can lead to false result. It can mislead you. It can mislead your results. It can mislead your conclusions. So this can occur at any step of the research. It can occur at the data collection procedure. It can occur at the analysis of data. It can occur at the level of publication of your data. So this is a basic error, a systematic error, which can deviate a researcher from the truth, and the results can be wrong. The results can be false. For example, if you see this is the truth, and this is an untruth fact, and the experimenter is stuck between the untruth and the truth and the truth again and untruth again, he will be confused. He or she will be confused what is truth and what is non-truth. That is what in today's lecture we are discussing about the types of the bias, because eventually we all are researcher. You people do research in the ninth semester. In the 10th semester you will actually execute that research. So you have to be aware with all the terms which all the errors you can face during your research process. So bias is a fundamental concept in epidemiology. This is deviation of results or inferences from the truth, or this is a process leading to such deviation. This is result of errors. This is not random but systematic, and results can be invalid, and it results mainly from the faulty design of the research, where you can uh, where bias can happen. It can happen at the level of study design. It can happen in the data collection procedure. It can happen in the process of data analysis, or it can happen at the publication level. So there are a number of steps where a researcher or an experimenter can face bias. Then this is responsibility of our it's our responsibility with how to minimize in the in this process, that our results must not be they must not be false, and we must identify the true facts. So when bias can happen, systematic error is introduced into sampling or testing by selecting or encouraging one outcome. So let's resume after the azan. Okay, let's resume the lecture. So we were discussing about the levels where bias can happen. It can happen in the data collection procedure. It can happen at analysis level. Moreover, it can happen at the publication level as well. So when bias can happen, systematic error is introduced into sampling or testing by selecting or encouraging one outcome or answer over others. So, you know, these kind of errors anyone can face during the research process, but still it is introduced into sampling or into testing procedure by selecting one outcome over other. So how World Health Organization classifies bias? According to a WHO classification, selection bias is there, which occurs from the manner in which study population is selected. So it is up to the researcher that what persons, what participants, or what representation he or she is being selecting from the population that can also introduce a bias in your study. And this is the most common type of bias in the health research. This is important MCQ student. This is seen in observational and analytical type of studies, and there can also be ascertainment or information bias, which occurs due to measurement error or misclassification of subjects according to one or more variables. So selection bias is a very simple type of bias which can be happening, due to the misselection of the participants, which can happen due to the wrong participation, the wrong selection. So selection bias, this is one of the most common error you can face, and information biases can happen due to measurement errors or misclassification of subjects according to one or more variables. So sources of bias can be anyone during the research process. A researcher or investigator can be a source of bias. The participants can be a source of bias. Statistician can be source of bias. Your literature can be source of bias. Your questionnaires, your tools, your instruments, they can be sources of bias or extraneous variable. For example, you're working on a variable and there comes another variable into which you are not interested, but that variable you know, is affecting your variable, then that those kind of variables they can also lead to bias in the research. So source of bias are very simple. A researcher can do some, some wrong selection or some he can do, he can produce some bias in the research. Your participants, they can cause bias in the research. Your statistician during the statistical analysis, your evidence through which you are, utilizing some information, that misleading information can lead to, some kind of bias into your research. In the selection of instrument, that is the tool, that is the your questionnaire, your outcome, or your data collecting the tool, that can introduce bias into the study, or some other variables that are affecting your variable, because there is a variable. For example, you're working on a person uh, who is um, who is having some complaint of cough. You're working on the cough, but your cough is, let's suppose, the coughing person is your variable, but he is also a smoker. Smoking can affect his coughing, so that smoking habit can be some extra variable into which we were not interested, but actually as it is affecting the coughing pattern or the coughing complaint, so that can be, yeah, extraneous variable or some confounding variable. But about these we will discuss in the detail. So major source of bias in clinical research, they are dividing soon. They are dividing actually the sources of bias into the three categories. The pre-trial bias, when you are just documenting your work, when you are at the you are at a synopsis level. Second, bias during the trial, when you are doing the data collection. In the first step, you are just documenting the research proposal. In the second, when you are actually conducting the data collection procedure. And the third one is when you have done the complete research and now your research is ready to publish, or your research is ready. And so these are the basic levels where there is bias can happen at the initial level before the data collection or before the trial. Pre-trial bias, that is the second type, is the bias during the trial, and third is the bias after the trial. So what are these type of bias we will see in the upcoming slides. So let's start with the bias prior to the study or to the trial. What is selection bias and how to manage the selection, in this lecture there are a number of people sitting, but they are selecting just 2%. And what was the inclusion criteria, what was the exclusion criteria, we don't know any the research, and also they can lead to again the some bias. Selection bias may occur during identification of study population. So this type of bias will happen during the selection of the participants. The ideal study population is clearly defined, accessible, reliable, and it is at increased risk, and it is at increased risk to develop the outcome of interest. So, how to do selection of the or how to do recruitment of the participants? We have to follow always our criteria, and if you don't follow that selection criteria, you can, face selection bias. When the criteria used to recruit and enroll patients into a separate study cohorts, they are inherently different. And errors introduced when the study population does not include the target population. You are not fulfilling the criteria of the inclusion of the participants, or you are not targeting your target population through out of your study population, then obviously selection bias can be there. And where selection bias can happen, this can be a particular problem, especially with the selection of the cases and controls in the case control study, and also in the cohort studies where you have to design the groups of the patients. And in the prospective studies, this is usually very less selection bias, because when we are conducting a randomized control trial, I will tell you in the next lectures what is randomized control trial. But I have told you that this is at the second or the third level, you can say, at the to be level of the level of evidence. So in the at the RCT level, selection bias is less, but in the case control study, selection bias has more chances to occur. For example, if you see in this descriptive study, no selection bias is there if the source, the population is same as we have taken for the study population, for the study sample. But if we are doing the study on this population and we are not targeting the exact population, exact target population, some other persons or some wrong kind of selection can be done, and that can lead to the selection. As for example, you can see here there are all the errors within with the very thin lines, but in this we have selected the thin arrows along with the thick arrows. So an even dispersion of the arrows shows that there is not even selection of population, but there is even selection of the sample or the population. While in the analytical study, you can see here that they are actually targeting all the cohorts, while in this kind of the second comparative diagram, they are just targeting on the two cohorts. So there can be selection bias while there is not selection bias. Basically, what is the difference between descriptive and analytical study? I must tell you in the very simple terms, because these things are they are actually related to the research, but I just want to clear this term in order to avoid you from the confusion. Analytical studies are, they are kind of inferential studies in which you discuss in detail about the variables, about the relationship of variables. Or in the descriptive studies, you see just what phenomena or what is going on in a population, and we do not, put much effort doing the descriptive study. For example, we see, okay, fine, out of 8 students, 3 students are doing smoking. Or in an ethical study, uh, we can find out the relationship of smoking habit of the student in some other thing. So in the descriptive studies, we just see what is going on inside the population and why it is being done, why it is being happening. This is not of our concern. While in an analytical study, we used to dig out the variables. We want to do inferential studies. We want to go into details. All the RCTs, the cross-section studies, they are all the types of studies, major types, they are of analytical type. While in the descriptive studies, there can the case report, the case series, the cross-section studies, they are basically the simple descriptive studies. Okay, the prevalence studies, they all are the descriptive studies. For example, in the selection bias, they're giving you an example. In the This is a case control study. The outcome was hemorrhagic stroke. Exposure was appetite suppressant product that contain PPA components. So cases were the persons who experienced stroke, while the controls were the persons in the community without stroke. And bias can be happen because of the control subjects were recruited by random digit dialing from 9 a.m. to time to 5 p.m. So this resulted in overrepresentation of unemployed persons who may not represent the study base in terms of use of appetite suppressant products. Okay, so in the case control study, although the cases are the persons who are with the complaint of stroke, while the controls were without stroke, but the involvement of controls was that because they have not used that thing about which we were discussing, or we were, we wanted to find out. So might be the controls have been selected, those controls have been selected who have not undergone the experience of using of that, above mentioned product. So, for example, in the systematic differences in the characteristics of participants at the start of trial, in the intervention group you are taking apples, and in the control group you are taking orange. It's definitely everyone knows that there is no comparison of apples with the oranges. So, these kind of recruitments can lead to selection bias. And how to reduce selection bias? Obviously, study population should be clearly identified. The study population should be clearly defined. Defined inclusion criteria must be there, and the choice of right comparison or reference group is crucial. While what we do in the cohort study, exposed and unexposed group should be identical, but for the exposure, so this is how you can reduce the chances of happening of selection bias. For example, the study population, the target population is of these all these workers, and the study population or the study sample, they are of of smaller size. So now we have to we must remember what was our inclusion criteria, and we must remain inside that criteria in the selection of the study sample. Okay. Okay. There is an important point which you must know, that in the clinical trial, what we can do to reduce the selection bias, we can go for the blinding. Now, what is blinding? Blinding is a concept in which we use that when we are doing the study on a thing, that we keep our researchers, we keep our participants unaware of that thing. So when you are taking participate, when you are taking part in a research, but you do not know about that what is this thing or what is that thing, and you're just a participant of the research, then you cannot you cannot go for favoritism of this thing or that thing. So this is how we can avoid the favoritism or the biases in the researches. For example, in this diagram you can see they all are the patient, they have randomly assigned them as we do in the RCTs. So this is the treatment group and this is the control group. Okay, and in the follow up, we will be taking the results. What what were there showing that the participants have some dual characteristics as well. So you have to go for the very clear, very precise, and very sharp inclusion criteria. Defined criteria of selection of diseased and non-diseased participants, which must be independent of exposures in case. In the case control study, defined criteria of selection and use randomization. So this is how we can minimize the chances of selection bias. Uh, okay, they're saying, can we find the average height of Americans based on a sample of NBA players? Then this be example of selection bias or not? They are asking it. Second comes the channeling bias. This bias is more likely in the non-randomized trial when the patient assignment to groups is performed by medical personnel. Okay, so channeling bias occurs when patient prognostic factors or degree of illness dictates the study cohort into which patients are placed. So, if a person is aware about the level of prognosis or the degree of severity of illness of the person, then he or she can place the patient in this or that group. That will be dependent upon that person. Huh? So that can lead to the channeling bias. And channeling bias is commonly seen in pharmaceutical trials comparing old and new drugs to one and other. For example, in this RCT example, you can see here that through that out of this population, they selected a sample and then they randomly divided the sample into two groups. In the group one, they gave the vitamin C intervention, and in the grade two, they gave no vitamin C. And the persons were suffering from the flu, so they have to go for the persons who were with flu and without flu in both groups, in the intervention group and in the placebo group. So this is how we can, see the things. And or you can go for random sequence generation, which I have told you about in the random uh, in the probability simple random selection. So you can use that type of sampling technique as well. It occurs at the start of trial before allocation of participants. It avoids selection bias, determines the random order of assigning people into intervention and control groups. It avoids systematic differences between groups and accounts for known and unknown confounders. So you can go for the simple convenience sample, so simple random sampling as well. Or you can do allocation concealment, you can do the allocations blindly. It can also lead to avoidance of selection bias. And when a person is recruited to the study, no one can predict which group they will be allocated to. So you can do a very blind allocation. So these are the things you can do in order to avoid the selection bias. Okay. In this diagram, what they are showing, the patient's condition fits the trial and she has consented which treatment pack should I give her. Okay, you are asking him that about treatment group A, treatment group B, or or the case, or I must keep him into some control group. So that is obviously the kind of um, bias, because you are that is not the blinded allocation they are asking. And so you have to check these things if you want to do a very authentic study and you want to do research without false results. So in the pre-trial bias, you can face problem selection bias or the channeling bias. So you must check things. Okay, the bias during the trial, which can be faced, they are the information bias. Bias occurs in the measurement of an exposure or outcome. So, thus, the information obtained and recorded from the patients in different study groups is unequal in some way, and many subtypes of information bias can occur. For example, you have to, for example, just see this diagram. The person is going to take the measurement of something, and he is confused that I must take this measurement into the millimeters or into the centimeters. So he is not sure about. So he has not, if the measurement has to be taken in millimeters and you take your millimeters into the centimeter, then the results will be entirely different because they were of the millimeters. No? So these kind of wrong measurements of the variables or outcomes, they can lead to information bias. So these are the biases arising from the mismeasurement or errorful classification of study variables. So these kind of biases we must consider, and they are also having a lot of subtypes. First one is the interviewer bias, chronology bias, recall bias, loss to follow up, biases from misclassification of patients, and performance bias. So let's have a look on these, and they are very much simple. You are very much familiar with the data collection procedure. You know the components of methodology. You know what is the data collection procedure. You know all the steps I have told you when we were discussing the critical basis. So let's have a look on this. And first of all, let's start with the interview bias. You're asking me some questions, and it's up to me that what kind of answers I will give you. That depends on my mood, that depends upon my aptitude, that depends upon my taste. Anything can affect my answer. So, interview bias, systematic differences in the soliciting, recording, or interpretation of information from the study party. It can affect every type of study and may occur when interviewers are not blinded to exposure or outcome status of participants. So students are asking the questions from their study participants in their answers and the recording of data and in the interpretation of answers or information there can be bias. So interview bias can be minimized or eliminated if interviewer is blinded to the outcome of interest. I'm giving you some answer, you're recording some other answer, or you're interpreting my answer according to your understanding. That can lead to development of interview bias. For example, in this diagram, um, this is a doctor and there are some patients. This doctor gives this blue pills to this patient, and this doctor is also the same doctor is giving pink pills to this patient, and then he will ask both of them about the effects. So if blue pills are are fake, then the patient will say, no, I'm not feeling better. Then our doctor will be thinking, these were not the true medicine, that was a placebo, na? So there must be no effect. But if the doctor does not know that that was a sham intervention, that was a fake treatment, then obviously this kind of things can be avoided. So in the interviewer bias, you can avoid that certain things just by using the blinding method or the concealment method about your variables or about your outcome. Okay. Okay. Okay, Ji. Uh, Chronology bias. This is bias which occurs when historic controls are used as comparison group for patients undergoing an intervention. Um, if I tell you chronology bias in a very simple definition, that this is kind of bias in which the time has to be considered as a defining criteria. For example, with the passage of time, the definition of this thing can be changed. Uh, with the passage of time, let's suppose with the passage of time, we used to identify the we used to classify osteoarthritis according to the symptoms. But now we used to classify osteoarthritis with help of an X-ray. Okay, so now with the passage of time, we are using the X-ray as a diagnostic criteria of the osteoarthritis. So this is how the, historically the things have been changed to define something or something. Also, secular trends within the medical system could affect how disease is diagnosed, how treatments are administered, or how preferred outcome measures are obtained. So, disease diagnosis, administration of treatments, and how to take this thing. This can this can lead to development of chronology bias. So time is a very potential confounder actually in this type of biasness. Each of these differences could act as a source of inequality between the historic controls and the intervention controls. It can be minimized by conducting prospective cohort or randomized control trial, or you can use the historic controls from only the very recent past. You can avoid you know the older things in order to minimize the chronology bias. Recall bias, what is this? Study group participants systematically differing the way data on exposure or outcome are recalled. You asking a question. I have suffered from ligamentous injury, and you asked me that your mechanism of injury was this. I was busy doing something, and when you were asking me the question, I didn't focus on your question, and I just answered, just in a very casual way. So the researcher recorded my answer as it is. So that can be the some that my answer was not right, and he has recorded the that thing, and that was a recall bias. My because of my wrong answers, because of my you know poor recallability or poor attention to do recall, he recorded the wrong answer. So when the study group participants, they systematically define the way data and exposure outcome are recalled. Particularly problematic in case control studies, individuals who have experienced a disease or adverse health outcomes, they may tend to think about possible causes of the outcome, and this can lead to differential recall. For example, they're giving this example. We have taken the person's whose children were suffering from cleft palate. Exposure was systemic infection during pregnancy. The cases were mothers giving to birth to the children with cleft palate and controls were mothers giving birth to the children to cleft palate. So the biasness can be there. The mothers who have given birth to the child with cleft palate, they may recall more thoroughly colds and other infections experienced during pregnancy. That is up to me that what I want to recall it, but I am, correlating with that thing. So this is example of recall twice. आपके साथ ऐसा हुआ था and she will say जी मेरे साथ ऐसा ही हुआ था. That is a recall bias. Okay. Okay, then comes the transfer bias in almost all clinical studies. Subjects are lost to follow up. If you are taking a sample size of 250 participants and because of some reason there are now only 196 persons in your study left. So now investigator must consider whether these patients are fundamentally different than those retained in the study or not, and researcher must also consider how to treat patients lost to follow-up in their analysis. So the follow-up loss can be it usually this thing usually happens in the in the controlled trials or in some kind of advanced studies. But how to cope with this thing? The researchers must he must take this thing very seriously before the start of the trial. Like how if this happens with me or in my study, how to tackle with this thing. Patient loss to follow-up can be minimized by offering convenience in the data collection, offering convenient officers, personalized patient contact via phone or email. You can call them to take this information. आपने इतने अरसे के बाद ये मुझे बताना है तो आप मुझे फ़ोन पे बता दें मुझे कि आप पेशेंट मेरे पास क्लिनिक आया तो if the patient is not convenient to come to your clinic then he will not come, he will be eventually be a part of loss or the you know a missed patient तो फ़ोन पे हम पूछ सकते हैं and physician needs the patient at the home. Okay, so this is how you can go for the you know the management of the transfer bias. So you can take if if your sample has a 250, then you can enroll 300 participants as well if that condition is so much prevalent. Then you can take data from more participants, you know, in order to facilitate the transfer bias initially. Then comes the performance bias in surgical trials. Performance bias may complicate efforts to establish a cause-effect relationship between procedures and outcomes. This kind of performance bias. The performance bias may complicate efforts to establish the relationship. So, to minimize or avoid what we can do, investigators can consider cluster stratification in one patient in all patients having one an operation by one surgeon at the same hospital. They're placed into the same study group, while in the second group, the same persons from the same surgeon from the same hospital, they can be placed in the second group. So you have to compare the performances of both surgeons from both hospitals, and you can take all the patients from their surgeons that have been undergoing the surgery. That patient will be in the group one and they will be in the group two. So you have to compare about the same thing. For example, you can compare the same students of the same class which are enrolled in the same course. Only then you can compare the performance of both students. So this is how you can compare the things between the persons. Mm, okay. Okay. Ji. This is how you are taking the the that these issues they are very much frequent in the conducting research, but obviously solution is there. So being a good researcher, you must be aware of all the biases you can face before your study, after your study, during the conduction of your study, and you must be aware of all the possible solutions as well. Missing information bias, yeah, very much important. If you are using a standardized measurement instrument, then obviously you will administer instrument or your tool or your questionnaire equally to both groups, the case and the control group. Then we are using multiple sources of information. We are using the questionnaires, registers, some PST cards, some direct arguments. But still, there can be some misinformation. And how to tackle with that? And if you have, some missed kind of entry, some missed kind of data, uh, or some, or you have forgotten to take data from that thing, that participant or that participant, then there can be issue of the missing information. So you must minimize information by using standardized measurement instrument, administer the same things into same groups, and you can use multiple sources of information in order to minimize the missing information. Okay, so this was about the biases during the trial. Before first we discussed biases before the trial, then we discussed biases during the trial, and now biases after the trial. Obviously, study is ready. Continuous year results have been discussed. Now what? Bias after trials can occur during data analysis or publication. This is you know a relationship finding study. Now, in the research language, we it used to classify statistically the relationship either as a correlation or as a association. So, but the formulas for both things is say different. Association goes for some other variables, for other kind of variables with some other formula, while for the correlation, some other variables are there with some other formula, inferential formula or the statistical formula. So if you're finding the relationship and you're finding the relationship, you're finding the association, you believe those are categorical and you are applying the formula, the statistical formula of correlation, and obviously that will be the best in the during the data analysis. So there can be some kind of data analysis bias or there can be some publication bias. There is some citation bias. The researchers and trial sponsors may be unwilling to publish unfavorable results. Thus, positive results are more likely to be submitted for publication and you can results afterwards if you want your study to be published. This is the citation bias, okay, or the publication bias. All right. So, unfavorable results. They don't want to take that your study, so you can go for some change in the data and change in the results. So that is the bias because truth were telling that no, this phenomenon was not happening, but that you want to tell others this phenomenon was happening. Yes, it was happening, but in actual it was not happening. So now this thing is citation bias, the publication bias. You have changed the results of the study, not just in order to get it published. Thus, positive results are more likely to be submitted for publication than negative results. Existing inequalities in the medical literature may sway clinicians' opinions of the expected trials results before again. Unfortunately, negative results we have, you know. Um, okay, in recognition of citation bias, the International Committee of Medical Journal Articles released a consensus statement in 2004, which required all randomized controlled trials to be pre-registered within an approved clinical trial registry. This is how all the experimental studies need to be registered if you want to, publish publish them later. Um, So this is a very good step actually towards finding the true results. So what is confounding variable? This is a very interesting thing. Confounding variable, which is not related to you directly, but indirectly it is teasing you, it is teasing the results. Confounding variable or the confounding occurs when an observed association is due to three factors: exposure, the outcome of the interest, or the third factor, which is independently associated with both outcomes of interest or exposure. For example, this is your independent variable, or this is your dependent variable, and in between there comes another variable. For example, you are conducting a study on the persons who have very very minimum physical activity. So, physical activity level is my one variable, and gain in weight is my other variable. So I'm looking for the relationship of weight gain and the low level of physical activity with each other. But there comes another factor that that person is obese, or or you can say that that person is, is high in age. Then age can be the confounding variable. Um, that high BMI can be a confounding variable. The variable about which I am not interested directly, I am not working on that, but that variable is actually teasing my both variables. आप स्टडी कर रहे हैं किसी एक पर्सन को जिसको फ्लू है, लेट्स सपोज अ पर्सन, यू आर स्टडिंग द पर्सन विद सोर थ्रोट है, और आप उनको दे रहे हैं साथ लेट्स सपोज आप उनको विटामिन सी दे रहे हैं, ठीक है, तो विटामिन सी का ताल्लुक सोर थ्रोट के साथ कि फर्क पड़ रहा है। मीनवाइल वो पर्सन क्या कर रहा है, वो पर्सन बदहतियाती कर रहा है, ठंडा या कुछ खट्टा खा रहा है। तो विटामिन सी का ताल्लुक तो आप देखने चले हैं सोर थ्रोट के साथ, लेकिन आप ये भी देखेंगे कि दोनों, आप इन दोनों के ताल्लुक को देखते हैं, लेकिन मीनवाइल पर्सन जो है कि ठंडा खा के या खट्टा खा के क्या नहीं कर रहा है। अब वो हम उन दोनों वेरिएबल्स को तो देखते जा रहे हैं, लेकिन वो जो उसकी यू नो जो खट्टा ठंडा खाना है वो उसको कंफाउंड कर रहे हैं उस चीज़ को। वो पर्सन तो वो खाता जा रहा है, क्योंकि हमारा तो ताल्लुक सिर्फ विटामिन सी इनटेक पे है, हमारा ध्यान था, क्योंकि वो सारे की सोच पे या फ्लू पे, तो वो तो कंफाउंडिंग वेरिएबल आ जाएगा जिसमें उसका जो भी वो खा पे, ठीक है। तो इस तरीके से कंफाउंडिंग वेरिएबल खराब कर देते हैं आपके रिजल्ट्स को। लेट्स सपोज coffee drinking effect is being seen in the development of pancreatic cancer, but that person is simultaneously a smoker, so smoking will be the confounding variable, because smoking can also be the cause of the pancreatic cancer, not only the coffee drinking. But if the person is only the coffee drinker, then only we can go to see that thing. But if the person is also the smoker, then that smoking will be the confounding variable. So, what are the methods to control confounding variables? Pre-trial study design is preferred method. Tools to control for confining variable, obviously. Prior to the study, matching patients for demographics and risk factors on, some other factors that can lead to similar cohorts among identified confounders. Through randomization can be done here, or, the effect of unmeasured or unknown confounders may only be controlled by true randomization and study with a large sample size, alright? And after studies conclude, identified confounders can be controlled by analyzing for an association between exposure or outcome only in cohorts similar for the identified confounding factor. Just have a look for the number of person, and then you have to randomize them into the two groups and control agents or the case handler. Similarly, internal validity refers to the reliability or accuracy of the study of the results. Alright, how much my results are valid, and external validity of the research design deals with the degree to which the findings are able to be generalized to other groups or populations as well. So, very simple difference between both types. Although we have discussed validity in detail, but that was the validity of the outcome I tool, and this is something else. This is validity of the results of the study. So, internal validity is the reliability or accuracy of the study results, while external validity is the basically degree to which the findings can be generalized to other persons, other population, other groups as well. Okay. Um, in internal validity, they say that was the research went right, results ठीक हैं. External validity में वो कह रहे हैं कि does the same thing happen in other settings, और ये भी हम कर सकते हैं. So if there is high internal validity, study design, implementation, data analysis have minimized or eliminated bias, or that findings are representative of the true association between exposure and the outcome. Okay. What is the short statement? It provides a concise 22-point checklist for authors reporting the results. So that's just have a look, just have an idea about the short statement. So let's look what are the types of bias: selection bias, bias in the study management, assessment bias, bias introduced after randomization is the publication bias. कैसे कंट्रोल करेंगे जी? सिलेक्शन बायस को आप कर सकते हैं कंट्रोल थ्रू द randomization or the concealment method. During the study design, you can go for the training of the research person, you can go for the concealment. Ascertainment bias by blinding of the researchers, bias introduced after randomization, then you can go for intention to treat analysis, and publication bias by the prospective registration trials, you can do that. Okay, so bias limiting measures are scientific collection of sample, matching, blinding, randomization, standardization of instruments, standardization of examiners. So this is how that we can go for, you know, go for bias limiting measures. So just have a look at the research evidence or the evidence pyramid or the hierarchy. As you go up, then the chances of bias happening, it usually decreases. It downs, decreases down. So in the randomized control trial, they say it is shown. In the further study, they say it is likely. In the uncontrolled trial, they say there can be possibility, and in the exploration, they said this can happen. So summary bias is any trend or deviation in truth which can cause false results. It can occur either intentionally or unintentionally due to consequences of bias. It is unethical to conduct or publish a biased research when unintentionally confounding a bias is also saying that every researcher should be aware of all the potential sources of bias and take all possible actions to reduce and minimize the deviation from the field. So these are some examples. You can have a look at those case scenarios with the bias. Selection bias, information bias, and the confounding bias is again. So the last thing is that bias threaten internal and external validity, because internal validity was about telling you about the accuracy of the results, and external validity was telling you about the generalizability of the results. Okay. Okay. So anything if you want to ask, you can ask me now.